We continue our discussion on mental illness in the prisons by talking about diversion and reentry and the strategies for discharging these offenders that are living with a mental illness. President Bush said, "America is the land of the second chance, and when the gates of the prison open, the path ahead should be a better life." That is what we hope when an offender leaves prison incarceration. A longtime advocate of the mental health courts, Judge Steve Leifman, stated, "We have a criminal justice system which has a very clear purpose. You get arrested, we want justice. We try you, and justice hopefully prevails. It was never built to handle people that were very, very ill, at least with mental illness." Our system was built as a punishment to as a deterrent for future offending, and it was not built to just house those with a mental illness. Munitz and Griffin's intercept model identifies 5 points in sequential order for intervention, encompassing both pre- and post-booking. Police and emergency service providers, after arrest and initial hearings, as seen, for example, in the statewide post-booking diversion program, after first appearance hearings via assessments in jail, discharge planning, and linkage to appropriate treatment should be ensured for those individuals that are re-entering the community after incarceration. The utilization of community corrections, for example, probation officers, that can assist in helping these individuals link up with treatment in the community. Osher and Associates, the APIC model for discharge planning stands for Assess, Plan, Identify, and Coordinate. Steadman and Associates contend that there are 2 essential elements necessary for these diversion programs to be successful. One is aggressive linkage to any array of community services, and the other is non-traditional case managers. As we've talked about before, it's so important that when anyone is released from jail or prison that they are followed up in the community and not just open the door, here's your medication. The New York City Department of Corrections means for providing care for persons with mental illnesses released from its custody prior to the Brad H. lawsuit was $1.50 in cash and 2 fare Metro cards. New York's mental hygiene law stipulates that providers of inpatient mental health treatment services must provide discharge planning. Henry Douglas and Eric Roskas were special masters put in place to monitor compliance with this Brad H. lawsuit. Oftentimes, the terms diversion and reentry are used interchangeably when we talk about discharge planning, and discharge planning can take place with both diversion and reentry. Department of Corrections involvement in discharge planning varies from state to state. We know this, and it also will rely on the budget. Flight and dangerousness are the 2 primary considerations involved in pretrial release and bail decisions. According to TAPP, no specific model for organizing all jail diversion programs has been designed or is currently in existence. Again, we're talking about the lack of training. The majority of the state's SSI and Medicaid offices refuse to receive applications from incarcerated individuals who are asking for reinstatement of benefits upon release. Maintaining access to these benefits enhances linkages to care and reduces the monetary burden on the governments in order to keep that going. Remember, we talked about that last module about the reinstatement and continuing their benefits while incarcerated. As indicated in your readings, approximately 750,000 persons are released from U.S. federal and state prisons each year, and millions more are released from jails. During the first 2 weeks after release, former prisoners released back into society have 12 times the rate of death than the general population. Steadman and Naples noted that jail diversion resulted in less time spent in jail, with an average of 2 months more spent in society for persons with mental illnesses diverted from jail. And this was accomplished without an increased risk of victimization to the community. And we talked about this before, that jail diversion can result in enhanced services, as well as reducing the amount of time incarcerated. According to Travis, 20% of inmates that are returning to society each year do so without any conditions to monitor or control them in society. So meaning that when they are released from prison or jails, there's no one following them. Also, according to Travis, re-entry applies to state or federal prisoners returning to the community, as well as to persons returning to the community from jails. A public defender, Stephen Bush, from Memphis, Tennessee, he discussed the involvement of the Memphis Police Department's CIT program that we talked about earlier in the class, pretrial services, and the Memphis Public Defender's Office, and how to link people with a mental illness from the criminal justice system to treatment within the community. He described conditional orders of release, and we've heard about these before, that the courts use in Memphis to release persons with a mental illness that are represented by the public defender's office into the community while awaiting disposition of their case. So they are being monitored, but then again, what are the percentages that we're looking at of public defender to offender? The public defender's office actually gets involved in brokering services for treatment and linking individuals to those services via an employed boundary spanner. It's funded from a state mental health grant. Conditional release can serve as a logical means to link individuals voluntarily to treatment, and such accepted treatment can prove advantageous to persons with mental illnesses in obtaining more favorable case dispositions with the prosecutor's office. The boundary spanners, or these resource brokers that we're talking about, they operate to identify community resources such as in the areas of mental health, housing, and vocational employment possibilities. And then they help match up the returning offenders that are in need of those services under their supervision. Discharge planning. 1/3 of prisons fail to link prisoners with mental illnesses with a mental health treatment provider upon release into the community. The Bexar Center noted that 1/3 of jail and prison inmates receive this key component of reentry and discharge planning. Remember, we talked about before, discharge planning should begin the first day of incarceration. Also, in a National Institute of Corrections study, less than half of the responding corrections departments acknowledge even partnering with community mental health providers in order to link these treatment with the persons being released. According to research, reported discharge planning for persons with mental illnesses to be the least often provided mental health service offered by jails. Also found the larger the jail, the less likely discharge planning would be provided for persons with a mental illness, and persons with mental illnesses who have brief contacts with jails require quick interventions that are somewhat different from individuals with extensive stay in jails and prisons. The Nathaniel Project. This is a unique project that I hope you read about within your textbook. It is a 2-year alternative to incarceration program that was established in New York for those people with a mental illness who have committed a felony. The program targets violent felons. They refer to their program as intrusive case management due to the intensive scrutiny that participants receive. And usually a client pleads guilty and is released to the custody of the program. Successful completion equals no incarceration. Failure equals extensive time in state prison. ACT, we've talked about this before, Assertive Community Treatment, includes all of the following: case management, non-psychiatric medical care, health education, mental health and drug treatment, employment and housing assistance, family support and education, client advocacy and ongoing assessments, availability of 24-hour services. Criminal justice authorities that are leading the way are growing tired of the recycling of persons with mental illnesses and the criminal justice system just being a costly dumping ground, as we talked about before, just being dumped into the system. In a study of 50 prisoner reentry programs for persons with mental illness nationally, it was found that criminal justice authorities headed 37 of the initiatives for the programs. If this trend continues, the system will become a primary funder of treatment services for those with a mental illness. This could be further indicative of the mental health system's reluctance to deal with this population. Again, talking about the same thing throughout this entire course, that the mental health system doesn't want to deal with persons diagnosed with a mental illness or those suffering from a mental illness. Instead, it's easier to just dump them into the criminal justice system. Forensic Assertive Community Treatment FACT. It's Community Treatment Alternatives. It's a FACT program located in Wisconsin. While they may offer promise as a cost-effective alternative, the verdict remains out on its impact on recidivism. It's too new to be able to decide whether it does, how it impacts recidivism. ACT was initially developed to assist persons with severe mental illnesses to function in the community while attempting to prevent homelessness and hospitalizations by connecting them with the services within the community. It's been rigorously tested and has scientific support for reducing hospital admissions. Because we're supporting them, we're connecting them with community services. However, FACT adds the dimension of trying to prevent arrest and incarceration of these people with a mental illness. The Threshold program is another program. It's in Chicago. It uses a version of assertive community treatment. In a study of the first 30 patients enrolled in the project, the total number of jail days dropped from 2,700 to 469 during the first year of enrollment. The total number of hospital days dropped from 2,100 to 321 for the group. So the total savings in jail cost during this study was $157,000, and a total savings in hospital cost was $917,000. So here is evidence that this assertive treatment in the community reduces overall cost. In Rochester, New York, an ACT program that receives its referrals from jail is Project Link. And unlike most studies involving ACT and intensive case management, resulted in a significant contribution to reducing incarceration. Project Link may actually succeed in reducing jail and hospital recidivism by utilizing service integration, connecting these individuals with service within the community can actually reduce jail and hospital. Project Link integrates and spans healthcare, social services, and the criminal justice system. It combines a mobile treatment team, a forensic psychiatrist, dual diagnosis treatment residents, and a culturally competent staff. All of these individuals working together to provide services. As we said before, in the mental health courts, this is where this starts as well, because all of these individuals, the forensic psychiatrist, diagnosis treatment teams, competent social workers, clinical providers, they're all involved to help these individuals. Combining elements of ACT and intensive care management, Project Link has significantly decreased the number of persons with a mental illness in jails and the number of hospitalizations. So here we are seeing a change and a decrease in these hospitalizations. In Harris County, Texas, where we know the criminal justice system is quite busy, an example of another partnership between mental health and criminal justice. Community mental health personnel literally follow the individuals into the jail system to provide a continuity of care. Remember, we talked about this before, about that's one reason that a mental illness can increase the behaviors and increase the diagnosis, is that they're receiving care within the community, and then when they are admitted into a jail or a prison, they lose that continuity of care. They lose the community services and many times have to start over again. This is especially detrimental to juveniles. CIT is in place, as well as assertive community treatment teams and a mobile crisis outreach team that can come to and assist persons with mental illnesses that are released from jail into the community who have difficulty accessing community mental health treatment. There's a very high percentage that will have that difficulty, especially if they don't have a support system in the community they return to. Pretrial service personnel are an individual's first appearance, and individuals being booked into the jail are cross-referenced with the mental health database system. The Suncoast Center, this is for community mental health in St. Petersburg, Florida, represents Florida's first forensic ACT team designed to exclusively handle individuals charged with felonies, albeit nonviolent in nature. You still have a lack of services to these individuals with a violent offense. The percentage of persons with a mental illness probations, Skeem and Loudon estimate that roughly 15% of those on probation or parole or supervised release have a mental illness. Slate and Associates report that 18% of persons under federal probation and pretrial officer supervision have a special condition of mental health treatment imposed. Probation officers are not properly skilled to deal with persons with a mental illness in terms of community supervision. You know, their job is really monitoring them and decreasing recidivism, watching their offending behaviors, making sure that they're employed, they're attending any group therapy that they need to. Slate and Associates recommended 40 hours of annual training for those entrusted with supervision of persons with a mental illness. And as we've said before, we're looking back at what training, how important it is. And they recommend that probation officers have specialized mental health caseloads of no more than 35 persons to be supervised. If they are trained in this and what to look for and how to help persons with a mental illness, then they know what to look for in the community and the signals when they might be going backwards, might be needing more community assistance. HIPAA requirements can be circumvented via court orders and the signing of waivers of consent. As we know, these HIPAA requirements can restrict services, especially because we know that persons with a mental illness, we're missing that link from mental health to the criminal justice system. But as we saw earlier, one of these programs, they're helping to connect these areas. Probation conditions can be crafted in such a manner as to obtain consent in writing of the probationer for release of mental health records, and this allows officers as part of the treatment team. So they can now, as we know, any kind of mental health medical records are protected. So when a probationer is in the community, but the probation officer doesn't know about their mental illness, they can't help them. They're not familiar with it. So by having these written consents, now the probation officers can have access to that information and can be an intricate part of the team. Hands Across Long Island offers discharge planning for both individuals who are being diverted from the criminal justice system and re-entering society from the criminal justice system. Both Hands Across Long Island and Howie T. Harp Center in New York City utilize peer support to help justice-involved persons with mental illness with recovery and re-entry. A clubhouse is a community of persons purposely organized to provide support to these people living with a mental illness. One can literally walk into a center and not be able to discern the persons with mental illnesses from the staff because they're all working together. Via these clubhouse participation, individuals are provided opportunities to regain friends, family, work, school, and access to the needed services they need within the community. Clubhouse participation cannot be court-ordered because participation is voluntary. However, it can be used as diversion from jail as long as involvement is not coerced. Recidivism, that's what we're talking about within our criminal justice system. It's estimated that at least 80% of all offenders that return to prison have a chronic physical, mental, and or substance abuse issue. According to research, more than 70% of the mentally ill offenders who were released from the jail in Ohio were rearrested within a 3-year period. And this goes back to what we were just talking about in community services and how to deal with persons with a mental illness. So these mentally ill offenders within the community are not getting the services that they so desperately need. Reportedly, in another study, 90% of the mentally ill inmates in Los Angeles were repeat offenders, with 10% of those having been incarcerated 10 or more times. 10 or more times. Travis and Associates report that parolees with mental illness who do not participate in the conditional release program 4 times more likely to reoffend. So we see how important it is for those with a mental illness to have that support within the community and participate in some type of release program. The highest risk of recidivism is said to be within the first 6 months of release. That is because, as we've seen before, not being able to get connected within those first 6 months, not being able to have support within the community, get a job, housing. Many times these offenders become homeless, and if they're not followed and they're not supervised accordingly, they will recidivate. Discharge protocols that fail to provide a network of support for released offenders with mental illness can only result in the continued recycling of persons with mental illnesses through the criminal justice system and needless suffering for these individuals and society. An individual with mental illness who repeatedly cycles between jail and the streets is known as a frequent flyer. Inmates with bipolar disorders have been found to be over 3 times more likely to have had 4 or greater prior incarcerations than prisoners with no major mental illnesses. This just reiterates what we've been saying. The acronym TAPP stands for Transition and Aftercare for Probationers and Parolees, and is a Georgia Department of Corrections reentry program. In a partnership between the Corrections and Georgia Department of Human Services, the Mental Health Division, case managers are assigned to prisoners that are released into the community and to probationers, and the case managers can then render assistance with mental health and medical care, as well as help with housing and job needs. Again, it's the importance of these reentry programs, getting them involved in this before they step out of that jail. In NAMI's grading the states, in this report, in 2006, the 2 highest scoring states were Connecticut and Ohio. They were bolstered by their significant use of programs to divert prisoners with a mental illness from jail. So not only are we looking at reentry programs, but we're talking about diversion programs to keeping those with a mental illness out of the jails. Likewise, in NAMI's most recent Grading the States report, 6 states were rated the highest with innovative programs in place involving collaborations with the Department of Corrections, reentry programs for young offenders, and mental health and drug courts in operation. It's all about the community and getting as many services and as many stakeholders involved as possible. Pre-trial release, deferred, as we've talked about how important it is if we can defer these individuals into a program or services instead of jail. Clark points to 2 exemplary jurisdictions, one in pretrial release in Hamilton County, Ohio, and another for deferred prosecution in Connecticut. MCES is a jail diversion program in Pennsylvania, and the acronym stands for Montgomery County Emergency Service. Another diversion program in Bexar County, program in San Antonio, prompted the Texas legislature to enact legislation requiring all community mental health centers to develop state-approved jail diversion strategies. So there are some counties and some states that are really focusing on jail diversion programs. And it's because, as the research shows, recidivism drops with diversion. The jail diversion program over 2.5 year time span resulted in $3.8 to $5 million in savings to the criminal justice system. The program is arranged in 3 phases. It initially screens persons with a mental illness that are picked up by law enforcement and make alternative recommendations to the magistrates prior to booking. So we're looking at diverting them instead of booking them to identify persons with a mental illness who have been booked into the system and make recommendations for alternative dispositions such as mental health bond or relocation to a mental health facility. This will ensure that persons upon release from jail are provided linkages to mental health treatment. Again, this is all working to divert them and a reentry if they are prosecuted. This diversion program includes a crisis care center, which is open around the clock, provides a valuable resource for law enforcement as a one-step receiving facility, providing psychiatric care, housing, and social work capabilities. Prior to the opening of the crisis care center, it was not uncommon for law enforcement officers to have wait times for up to 12 hours when bringing a person with a mental illness in to be evaluated. Now wait times on average. Remember, we talked about before in the first of the class about the importance of these crisis teams and knowing how to deal with persons with a mental illness. And here we have again the Crisis Care Center that is working as a diversion, works as a screening process. The Village Agency, another program to help those with mental ill. It provides services for homeless mentally ill in Los Angeles. Buchan reported impressive statistics regarding their efforts, with a 77% increase in permanent housing, 65% reduction in the number of incarcerations, 80% decrease in the total number of days participants were incarcerated, a 33% reduction in hospital admissions, and a 250% increase in the number of participants employed. Remember, that's what we're talking about here, is helping these offenders, and especially these persons with a mental illness, to become successful within their community. And being employed is a huge part of that success. Another criminal justice program in Maryland. It's been featured by the National Institute of Justice. It's a multi-agency discharge partnership that's initiated by the state. It's a partnership between mental health and criminal justice entities to screen for mental illness in jails, provide treatment and aftercare plans. Again, here we're looking at aftercare, which is so important. Linkages to treatment for persons with a mental illness in jails and when they are released. And the program now also includes provisions for services to persons with mental illnesses that are on probation or parole that are already in the community. So not only are we covering those before they leave, but this program is trying to go back and pick up on those that may not have been followed upon release. The forensic transition teams, they're composed... Sorry about the ringing of the phone. The forensic transition teams are composed of caseworkers and clinicians that have been established by the State Department of Mental Health in Massachusetts to assist with discharge planning and more linkages to the community treatment for those that are leaving prisons and jails that are diagnosed with a mental illness. Joan Galechi with the Maryland Mental Hygiene Administration reported that before the Shelter Plus program in Maryland was established, 80% of those with a severe mental illness were released from jail were rearrested within a year. 80%. But now with housing in place, and the recidivism rate has dropped dramatically to 4% of this population. Having these services in place and connecting those within the community drastically decreases recidivism. Discharge planning, we've talked about how important this is from the beginning, from the first day of entry. It's an essential part of successful reintegration of former detainees and prisoners with a mental illness. As noted by Barr, mental health treatment in jails and prisons has been mandated by the Supreme Court. However, discharge planning has largely been ignored by such institutions, even though there's a Supreme Court in '76 mandating the mental health treatment. Many of these institutions are ignoring it. The availability of services, this is where it's lacking within our institutions and our community. So the effectiveness of diversion is likely to depend on the availability of appropriate services in the community. And many diversion programs lack effective linkages to treatment. So in order to see the success we were just talking about, there has to be a work group from those in the prison to the programs within the community, as well as there has to be programs in the community that can help these offenders. So the lack of these services is a barrier that needs to be overcome.